syndrome in the Brain Saver books. Comprehensive, detailed information about restless legs. So let's get into it. Restless leg syndrome. Often when addressing restless legs, medical communities start with the legs first. Are you cramping? What's going on with your legs? Do you need leg massage? Do you need to lift your legs up? Maybe your problem's in your legs, but it's not, right? They'll ask, could that be the problem? It's just a leg problem. Try putting a pillow between your legs when you sleep. That'll fix it. How about that? Or they'll ask, how's your bed and your mattress? Go out and buy another $500 mattress or $300, $400, whatever it is, dollar mattress and replace your mattress. That'll fix your restless legs. Are your legs comfortable? Are they supporting your lower back when you lie down? That's the problem. You know, experts will be like, maybe you just need a little bit more support when you're in bed. Maybe you could put your leg up. Maybe you got your pillows between your knees, right, the whole bit. Okay, how are your feet? Maybe your restless leg syndrome is just your feet. Maybe you got a feet problem. You need to go and try on some new shoes, supportive shoes. Do the shoes fit right? Do they have enough padding? Are they the problem? Or is one leg shorter than the other? And everybody says, hey, my leg is an inch shorter than the other leg. My leg's a half inch shorter than the other leg. That must be my restless legs. And then so on, so on. If looking at the place where the symptoms are felt doesn't yield results, then the doctor may move on. Is it in your mind? Is your mind too active at night? Are you giving yourselves restless leg syndrome? So then you go through that whole thing. Is your mind too active when you're trying to sleep? Read a book. Read a book before you go to bed, right? You might hear that. Maybe light a candle and take a bath. Listen to some calming music you'll hear as advice. Consider taking magnesium for your legs. If none of this helps, often patients are told it's time for an MRI on their lower back to investigate for degenerative disc problems or a bulging disc. And if this all checks out, even if there is something like a bulging disc, doesn't mean that's your restless legs. If this doesn't check out or checks out, no signs of a structural spine issue, the restless legs will be considered a medical mystery. And that's the whole point with restless legs. It becomes a medical mystery. Everybody thinks science research is really advanced, but they don't even know the cause of restless legs. In here, it's detailed, comprehensive information. Let's go on a little further. If looking at the place where the symptoms are felt doesn't yield those results, instantly now we're at the medical mystery world. And that's really interesting. So, and here's the other point that's interesting too. If there's no signs of anything wrong, your feet, your legs, you tried everything, you tried the pillows, you tried the shoes, you went to the doctor, you got massage therapy, it's not a mystery when you look at the Brain Saver books. It's a medical mystery out there, but detailed information in here of what's really going on is really incredible here. There are some neurologists these days who will start looking into the brain a little bit. Now, I've seen that out there because of the medical medium books being out now for 8 years. They're starting to look at the brain a little bit, right? But even if the MRI and the brain look normal, there's nothing abnormal there, then where do they go from there? The true cause of restless legs would not appear on the MRI. So let's go into that. If you get an MRI, you're getting the restless legs for like a year and it's bothering you. You tried everything. You go to the doctor. The neurologist says, let's look in the brain. They do an MRI. They look through your brain. It looks pretty good. Nothing really is terribly wrong in here. Okay? Everything is checking out. The brain looks good. Nothing abnormal. Then they're going to be like, okay, let's try to go a different route. Let's go with sleep medications. Let's start going with different pharmaceuticals. They start heading to that place. The true cause of restless legs won't show up. So then they'll offer, hey, here's some sleep aid. Here's a sleep drug. Have you tried this? Have you tried that? So then it's going on to different places. Maybe you got anxiety. A lot of people with restless legs are blamed on anxiety. So they're like, well, I don't know if it's anxiety, but maybe it is. So now they're taking anti-anxiety. It's true, as well. Even if the scan showed a brain tumor, it wouldn't mean that that's the cause. And I run into that every now and then throughout, like talking to doctors. A doctor would be like, hey, AW, there's a brain tumor in my patient. Is that causing the restless legs? And well, first of all, let's try to get rid of the restless legs. They get rid of the restless legs, and it turns out the brain tumor wasn't causing the restless legs. So So even if someone has a lower back issue, it doesn't mean the lower back issue is the problem too. Someone could have a bulging disc, they can have a spine issue, they can have a sciatic nerve problem, they can have a degenerative disc issue, something can be wrong in their lower spine right here, and it doesn't mean that that's actually causing their restless legs. So that's another problem all on its own. So now you're at the chiropractor, and the chiropractor's trying to do all kinds of stuff, saying, well, ma'am, well, sir, your restless legs, probably because we're seeing there's an inconsistency right here in your lower spine, in your lumbar or your thoracic area. That must be where your restless legs are. So they start searching in those areas. But even with that, visiting your chiropractor over and over again, visiting your massage therapist, you've been to the doctor, you've had your MRIs, you've had a lot of things done and looked at, and you're still suffering with restless legs. Let's go into now the nitty gritty and some details right here. So we're in Brain Saver, talking about restless legs, you guys. Restless legs can come from two places. First is the shingles virus releasing neurotoxins that affect the lower spine. So let's head there. Shingles virus likes to sit around the lower spine for a lot of people. It likes to harbor in this area. The shingles virus can nest itself in connective tissue around the lower spine, then release neurotoxins. These neurotoxins can then inflame the sciatic nerve, other nerves too. So the shingles virus, without having the pustules, like the rash, can cause those restless legs. This is one of the undiscovered mysteries of restless legs, which is the neurotoxins created by the shingles virus, produced by the shingles virus, sitting inside the liver, is another problem. So the shingles virus doesn't just harbor around the lower spine. The shingles virus likes to sit around the liver too. So not just the lower spine. Shingles virus likes to sit around the liver as well, inside the liver, producing neurotoxins, and those neurotoxins start to gum up and fill up the liver. So when that liver gets filled with neurotoxins, we have another problem. So the liver can settle in different places. The neurotoxins can settle in different places inside the liver, depending on what those neurotoxins are filled with. So here's the incredible piece of information too, right here in Brain Saver. So we're in the details, you guys. Higher amounts of lead and copper being consumed by the shingles virus will result in a heavier neurotoxin. So check this out. If the virus is feeding off of different metals, it can actually create a heavier neurotoxin. So if the virus is sitting here feeding off of different metals, it could then produce a waste that comes out of the shingles virus, but a waste that's heavier. And when that waste is heavier, check this out. This is incredible, really. This is how you become your own expert right here. If higher amounts of lead and copper being consumed by the shingles virus are happening, then those heavier neurotoxins tend to settle in lower areas. They'll often drop into the lower back, legs, and feet, irritating the nerves and creating subtle spasms. So if you have certain toxic heavy metals and the shingles virus is feeding off of those metals, neurotoxins, are being released. They settle in lower areas of the body. Feet, the legs, the lower back, irritating the nerves, creating nerve spasms, giving somebody restless legs. Science and research is probably 50, 60 years from knowing this information, maybe even 100 years. Some varieties of Epstein-Barr can also create these heavier types of neurotoxins as well. So Epstein-Barr can create heavy neurotoxins. People can have restless legs all day long while standing and working or sitting and not realize it until they're still or lying down for the night. So let's talk about that. Are you somebody with restless leg syndrome when it's at night and you're trying to sleep? But during the day, when you're working, moving around, working in the kitchen, maybe doing your job, it's not bothering you? Like, where's your restless leg syndrome? So here you are, you're living your life. It's during the day, you're working, you're in the kitchen washing stuff, you're doing things, you're doing the laundry, you're walking around the house. Where's your restless legs? Is it there or is it not? But then when you lay down and it's sleep time, you get the restless legs. So people can have the restless legs all day long while standing, working or sitting and not realize it until they're still or laying down for the night. Here's the other way restless legs can occur. Viral neurotoxins filled with the same methylated metals can enter the brain. So then we can get a restless leg syndrome from viral neurotoxins entering the brain. That's a whole nother level of neurotoxins. You guys, there's so much information in here. I'm just cutting into some of them, scratching the surface. Restless Legs Protocol is in this book right here. So there are 2 books, 2 big books. Couldn't be published as one big book. It was too big, too much comprehensive information. 7 heavy metal detox cleanses, over 300 symptoms, conditions, and protocols, brain shot therapies, and I'm just scratching the surface of these books. I mean, there's meditations in these books. There's so much information. It's so comprehensive. Your mind will be blown when you get into this, but I will tell you right now, be prepared to become an expert. So nobody owns you. You're not controlled by anybody. You become empowered because you have the answers. You have the details. Your mind's going to be blown. Are you ready for it?